My vision ties in with that of the TEPHINET vision, and the vision of TEPHINET is to ensure that all citizens in the world are covered by a competent field epidemiology workforce that is able to protect it against outbreaks and episodes of ill health due to various diseases and pathogens. So my vision would be to extend the range of training in field epidemiology using the pyramidal model, so ensuring that every country in the world has either a 2-year training program or an intermediate training program or a frontline training program. And that, of course, all these programs are members of TEPHINET, so thus extending the reach and the range of the network itself. You know, the truth of the matter is TEPHINET is the only global network of all the field epidemiology training programs around the world. These training programs are housed in ministries of health and in institutes of public health largely. So TEPHINET is in a preferred position of being able to strengthen health systems and improve the health status of people by the fact of it being the network of these field epi training programs. And I think that's a critical consideration. It's important to remember that TEPHINET is a network of these field epidemiology training programs, as well as it's an implementing partner for various projects in different countries. And I'm really looking forward to reconnecting with colleagues around the world because they're all very important in the work that TEPHINET does. Every large organization has its challenges and has its issues that it has to deal with. And we are actually at a very interesting point in the development of the network. We've reached the point where we've developed a roadmap to determine the way forward in view of the funding challenges that we've had, the sustainability challenges, and there are a lot of work areas or areas for improvement that have been identified, some of which are obviously ownership of individual programs and sustainability, quality of the actual teaching programs, quality accreditation, the need for accreditation. And I think that going forward is going to be a very formative period where we determine how we're actually going to implement the strategy that was developed via the roadmap. And I think it's going to lead to different ways of doing business. It's going to strengthen the network. It's going to ensure the ownership and sustainability of individual FETP programs. And it's going to help us do what we do best as TEPHINET, as the network, and that is to support individual programs in their efforts at workforce development, particularly field epidemiology capacity development and strengthening.